Every year, new supplements hit the market claiming to accelerate tissue repair and recovery. In conclusion, CP supplementation did not enhance RT-induced tendinous tissue remodeling. It's a flat, null-result duro, exactly the kind of finding that supplement brands usually try to quietly bury. But the closer we looked at how they ran the trial itself, the less their underlying process held up. We're putting this trial's integrity on the stand. Let's dig into the details. Let's start with what they did right. The venue is solid. Medicine and Science in Sports and Exercise is a highly respected, top-tier journal, providing a credible foundation for the research. And jump to their methods, the core structure backs that up. This was a single-center randomized double-blind control trial, which is exactly the design you want for a supplement test. The foundational design checks out. They also set up strict controls to prevent bias during the intervention. Both supplements were provided in identical prepackaged sachets, except supplement code, thereby blinding both participants and investigators. The authors played it straight and didn't try to spin the data. The blinding protocol is exactly right. We ran the baseline data through our forensic checks to look for mathematical anomalies. When we look at the baseline structural and mechanical properties of the tendons, they did not differ between groups before the trial began. The groups started evenly matched. We also checked the distribution of their p-values across the board, and the numbers show no signs of impossible matching or statistical manipulation. The baseline math is completely clean. The visual reporting maintains that same level of transparency. When reporting group-level means, the authors also provided the scatter of individual participants directly in their charts. They aren't trying to hide the variance or deceive the reader visually. The visual integrity is solid, no issues here. But this is where the pristine setup starts to show cracks. Loughborough University Ethics Review Subcommittee granted ethical approval for the trial. But that's where the administrative rigor stopped. There is no trial registration filed before the study began, no sample size justification, and no public data release. They also ran multiple statistical tests across their variables without correcting for the inflated error rate. Transparency and statistical planning were skipped. The bigger problem emerged when we looked at who actually finished the protocol. 13 participants withdrew from the study before it ended. Out of 52 people randomized, a 25% dropout rate is massive, pushing well past the critical threshold where results start to warp. But look at the analysis plan for AUK. They compounded the error by using a per-protocol analysis, simply excluding the dropouts entirely. That completely destroys the randomization they started with. A massive attrition rate handled the wrong way. That's a fatal flaw. That lost randomization is even more damaging when you see how they assign people in the first place. The researchers state their metrics allowed participants to be pair-matched and then randomly assigned. But they never explain how that random sequence was actually generated. More importantly, they failed to report any mechanism for allocation concealment, leaving room for selection bias before the patients were even enrolled. No mechanism for allocation concealment, missing entirely. Finally, we looked at the financial incentives behind the trial. The authors declared that there is no conflict of interest, and the manuscript leaves out a funding section entirely. On its face, the paper presents itself as completely independent. An undisclosed corporate relationship. 4 minutes, 1 study, 0 spin. Subscribe. But jump back to page 3, and they explicitly name the proprietary Gelita-branded supplements they were supplied with. But what they don't disclose here is that the lead author's team has historical funding ties to the Collagen Research Institute, an organization closely affiliated with Gelita. The only reason this doesn't sync the paper completely is because the data showed the sponsor's product didn't work. The independent story gets complicated. Here is where the final audit leaves us. The final forensic score is 58 out of 100. Under normal circumstances, that's a mediocre but passing grade. But this study failed to conceal its patient allocation and suffered a massive 25% dropout rate. Those aren't just design weaknesses, they are critical failures that warp the reliability of the clinical outcomes. That single combination means every clinician and meta-analysis citing this paper is treating it as stronger evidence than it actually is. That triggers an automatic discard.